Okay, the chapter. Oh, wait a minute. What's going on here? Let me stop. All right, chapter 3 with regard to infection control is a really important chapter, although one that we more or less have been talking about from the very beginning. And certainly it includes hand washing and also just keeping yourself healthy. So the first thing to know with regard to infection control is what causes infections. And if you know the cause, you have a little bit of understanding about how they can be transmitted. And so you have different pathogens that cause infections, bacteria, fungi, viruses, anything that's capable of causing a lack of homeostasis in the patient, we think of as infection. In the layman's sense of the term, I guess you might say. Infections can be able to be transmitted one to another, so communicable, or they can be healthcare acquired, which we call nosocomial. Many infections are acquired in a healthcare facility. A person might go into the facility without pneumonia, but then acquire that particular pathogen in the hospital because many people are infected with it. So just understand those are two different types of infection. The best way to stop an infection is to break any link in the chain that you have here. So either try to eliminate the agent, like bacteria. Hand washing would be a useful tool. To eliminate the reservoir. It's one of the reasons why we clean our equipment, we clean our tables, make sure we are properly disposing of the blood, of say if we cover our cough in terms of exit pathways, means of transmission, we become aware of those and take precautions. If we are drawing blood on a patient that has a airborne transmission, then we wear a mask. And then entry pathway, make sure that we don't touch our eyes or with regard to body orifices, we try to encourage the patient not to do such things. And certainly you're welcome to double glove if you have cuts or broken skin. And then just general personal wellness, so susceptible host. And certainly if somebody is highly susceptible to infections, then we will put them on in isolation. Infection control, as I said, hand washing, so hand hygiene, alcohol-based antiseptic is what they're recommending now. So I'm not saying that won't change, because that does change. And then understand this idea of personal protective equipment. You have gloves, gowns, and lab coats. You have face shields and goggles and respirators. So we have levels of protection with all of these too, depending on what you're using. The order for donning PPEs is gown first, then mask. Make sure it covers your nose and mouth, and then your gloves. And then for removing, you remove your gloves first, and make sure you're moving them so that you are turning the outside in. So we can show you that in class, but what you do is you take one off, make sure the portion that was covering your hand is now on the outside, and the other one off, make sure the portion that was covering your hand is now on the outside. And then your gown, and then with the mask, you only untie the strings, or you only touch the device that's holding it on. We don't touch the mask itself. And then all of those are properly disposed of. If in fact they're biohazards, they're put in the biohazard container. If they need to be disposed in a even more, more infection control area, like if the person has Ebola or something like that, then they'll be put into even more serious type of biohazard. We do have isolation procedures with regard to that. Would be somebody who is either susceptible to infections or somebody who is infected, and we want to make sure they don't infect other people. And so the overview is that with communicable infections, they're separated from others, and that is one of our quality control measures to prevent the spread of infection. And if you have somebody who's either has a compromised immune system, meaning they're susceptible, they're going to be protected. It's always done on a doctor's orders, and the infected person's going to be in a private room, and sometimes even in a private wing. Again, according as per the Ebola, they were in a private patients there. If we had any, which we did not, we're going to be in a private wing. Types of isolation procedures: you have protective or reverse, and that's for a patient that's highly susceptible to infections. You think of somebody with a compromised immune system, somebody with low white blood cell count, somebody who's subject to burns, somebody who would just get the infection very easily. And then there are traditional, sometimes disease-specific, particularly if they're highly communicable, sometimes category-specific. Then you have this concept of universal precautions, which we've talked about, that all people are potentially infectious. And then, as I said before, with regard to the substances, if you're pulling out sputum, or you have mucus on your gloves, you're making sure that those things are isolated from the next patient you go to see, as well as all of their body fluids. In terms of more guidelines, you do have standard precautions also. It's the first strategy for those infections that are acquired in the hospital, and that's going to cover all body fluids and skin breaks and mucous membranes. And with that, we basically treat all of those elements, the body fluids, the skin breaks, and mucous membranes, like that particular person has all of that. We try to keep ourselves from getting it and spreading it to the next patient. We also try to make sure that that patient doesn't get it from another patient, if that makes sense. And then basically we look at the way something is transmitted. It can either be transmitted via air, it can be transmitted via sneeze, or where either sneeze or actually if you have fluids coming out, so it's surrounded by water or it's held in water, and then contact. It could be on the skin, or it could be on a fomite, so it could be on a table, etc. So we look at where does it come from. And then the last thing to talk about with regard to safety is bloodborne pathogens, which is a huge topic because we're working with blood. And one of the most common bloodborne pathogen, it's not easy to say fast, is Hep B. And best defense is your vaccination. That's that 3-part vaccination. Because hepatitis B lives in blood and other body fluids, and sometimes can survive on objects for a week, depending on the conditions. Needle sticks is the most common way that we look for trying to prevent it, and the symptoms are kind of flu-like symptom. Hepatitis C also is a bloodborne pathogen. This can also be transmitted via needle sticks and again, flu-like symptoms. So B and C. OSHA has regulated standards for bloodborne pathogens. It's one of the reasons why when you get your first job, they will require that you have that Hep B vaccine. There will be training in terms of trying to avoid dirty needle sticks. And there is also, so you have the availability of your PPEs, special training in terms of avoiding dirty needle sticks, making sure that the precautions are in place to make sure you don't have the dirty needle sticks, nor does anybody else have them. And then, as I said, the vaccines. It's all regulated and established by OSHA standard. In terms of part of the OSHA standard, every organization that you work for needs to have an incident exposure procedure in place. That procedure isn't just one that they come up with. It's been regulated by OSHA. What happens is remove the object, wash with soap and water. If it's mucous membranes that exposed, you flush the site, use an eye station, and what happens is a report has to be filled out, so that the supervisor fills the report out, and then follow up evaluation, treatment, and counseling for that. This is all part of your your capacity as an employee working at a place, and we also do that here, but what we try to do is make sure there aren't any dirty needle sticks. And that's the end of the chapter. Good luck on your test, and I will see you in class.